You're still on to the conversation on Lagos television. I did say earlier that we'll be looking at population control and its impact on Nigeria. We all know that population comes with opportunities as well as challenges, especially when it is not controlled or properly managed. It can also trigger poverty and unemployment if it is unchecked. But as we speak, we do not know the accurate figure or the population of Nigeria as we speak. So this morning we'll be looking at population control and the impact on the socio-economic development of Nigeria. And we have joining us this morning Abiodun Ajayi, public health advocate. It's a pleasure to have you.
Thank you very much, sir.
Okay, I think the best way to start this morning is for you to tell us how significant the population of any country is to its socio-economic growth.
All right, thank you very much for having me once again. I was here last year where we celebrated this same day, and it's also nice, coming often like this to discuss such a very big issue. United Nations designated every July 11th to commemorate the International Population Day. And this commemoration is not just to come and say we want to celebrate. It is for us to start identifying what are the gaps that we need to start focusing our governance to. And just like you asked, why is population control is very pivotal for every country. Number one, it also helps us set governance for the people. It also helps us identify what are the challenges people are facing, and then how can we start allocating allocating solutions based on population. If you realize that you said it earlier, we do not know the definite number of Nigerian population, and that is why governance is not reaching everybody. Why? Because we are not allocating infrastructural development. We are not allocating governance change
based on the
population. So somebody will come and say we are over 200 million people in the country. Some will also come and say we are over 230 million people in the country. We need to be definite. We need to, and that is why somebody will say the problem with Nigeria is not just because we have bad leadership. It is also because we do not have data. Data help us identify what you need to do. If I have 2 children, I know that I'm responsible. Everything I need to start thinking about is how to ensure that those 3 people or those 3 children are okay. So if I have 10, if I have 20, I know I am allocating based on the number that I have. So I think population control is very, very pivotal because it helps us know where gaps are and how to mitigate those gaps.
Okay, but why do we need to control when some people will tell you that, okay, if you have a large population, is actually an advantage for your economy? So why do I need to control it?
So when they say it is an advantage to them, it depends on the economic stand of each country.
Okay.
Take a look at China. China, for instance, they have more population, and they are able to control their population because they have sustainable economic system. Look at the US also. They have more population. Their people are getting the dividend of democracy that they deserve. Why? Because they are definite. The data is sitting on the table. They know the number of people in their country, and when they are creating economic agenda, they are planning with the number. They are not planning outside the number. So that is why you see them. When each of the states in America is providing change or economic solution, they are working based on data. And that is what Nigerian government needs to start focusing on. Even maybe when we get to that conversation, we need to advocate for the Nigerian population, the national population census, to come up. Let us know the number of people living in this country so that we can plan for family planning, we can plan for reproductive health system, we can plan for jobs, we can mitigate poverty issues and unemployment rate in the country.
I just feel that the conversation about Nigeria's population is just bloated. Because one, we are not as much as we keep banding.
Yeah.
Because one, I don't know how many kids your parents have. How many do you have?
Yeah.
I don't know about Jibola, but I do know virtually everyone in this room, our parents had more kids than the ones we have. So this one, I would say Nigeria's population is growing at a particular. I don't think that is true. Because virtually in this generation, we have more people having less kids than their parents. I'm sure that is true. So why are we talking about population control when, in fact, population is sometimes can be used as a yardstick to gauge development?
Yeah. So we are talking about it because, like I said earlier, we need to look at the country economic stand. We are facing poverty. We are faced with poverty today because someone who could not control the number of children he should have is having, I think we discussed it last year if you could remember, someone who is having 5 children and your economic outcomes cannot even take care of 2 and you keep having more. So when we say that we are not having children more than our parents, if you look at the economic situation at that time compared to now, where fuel price is now higher than it used to be, where the bag of rice is now higher than then, is not higher now than then. So these are issues that we are looking at. We are not saying that if you have the capacity, I said it on this platform, if you have the capacity to have 10, if you have the economic stability to have 20, so be it. It is your resources that will be used. But if you do not have that, we need to keep educating people to say that, why not have that control? If you are earning 50,000 naira and you have five children, when 2 get, I gave you a scenario of a family who his children out of 4 children or 5 children, 2 got sick, and then he couldn't take them to a good hospital. And I said maybe he took one of them to a quack nurse, and eventually they gave the child injection at a wrong place. The girl could not walk again. Do you understand? So these are the outcomes. These are the negative outcomes that befall the homes of people who do not control such number.
So which brings me to the question of, so what conversation should we be having? Because I know this present administration is trying to work on the census eventually. So what conversation should we be having? Is it to address the economic issues from government as against telling them to control their kids? Because if the economic situation of the country is way better, or better still, we have better economic policies that addresses those serious challenges of facilities and all that, as against to be talking about population control, because it is a very delicate conversation. Have you been to the north recently? Have you been to some states even in the southwest? You know that is a conversation, is a function of choice. And if you don't have work and your wife goes out and you, the man, you are at home, the outcome is you're going to have baby every I can bet you have baby every year interval. So is it not better to be talking about our economic status as a country, which data can give us, as against to be talking about population control?
Okay, so let me say this explicitly, that the issue at hand is not about enforcing families to have lesser children. There is no law restricting their decision. They have their right. They have the right to make their decision. If you look at this year's theme, it says that empowering young people to make decision, to create the families, to create the future that they deserve now, or that they hope for. So saying this, it therefore means that we want to keep educating people. Our own is to educate and say that this is the economic situation. If you do not have the capacity to sustain yourself within this economic situation, why not go for this option? So from the part of the government too, we keep advocating that at one of the ways at which we can control our population is to create sustainable economic system, is to create public health system that is quality, that is there to also give people that education that they want. Education in terms of health, education in terms of sexual and reproductive health, family planning, unemployment, and the likes. And that is why one of our own advocacy is that the government should revitalize our primary health care centers, where people can friendly go in and get the information that they need. All these all these poor people that we are talking about, or I don't know how to use that word, people who their economic system is not really good enough, can go in there and get the information that they want. They should also revive our youth-friendly centers and make it work for young people. Do you know that young people are getting more babies than before as we speak?
And
yes.
And what's the data? Because we are still complaining about data.
So
where is the data?
We have our own survey. We have done our own survey. We have done our own survey. Go to Badagry, for instance. You will see an 18-year-old girl in numbers nursing 2-child, 3-child. I can tell you for free. We have done our survey. We have our own report at our own organization. Last year alone, we conducted 2 surveys in different local governments in Lagos State. So we are not saying that government will make decisions for people. People make decisions themselves. But what we are saying is that government should also scale up all of this education that we are talking about. And that is where the population control comes in. Health education, SRH education, helping people with family planning information. It will also mitigate this unemployment issue. It will also help us mitigate poverty.
Poverty, yeah.
Somebody who is earning 50,000 is giving birth to 5. So if you caution such person through your education might reduce the number and go for family planning and begin to use that salary in the right way.
Okay, are there any significant signs or measures being put in place by state and federal governments that you can see that are really targeted towards ensuring that we do control population growth in the country? That is one.
Okay.
Then what are the means and ways of controlling this population growth in the country? Because you speak with some women and they will tell you that, okay, fine, I want to control the number of children that I intend to have, but I had a friend elsewhere telling me that if I do this particular control measure, there are going to be health risk involved. So put us through all that so that those who are watching can actually gain 1 or 2 things from what we are discussing this morning.
All right, thank you very much. I must commend the President of the Federal Republic of Nigeria for initiating the first of its kind health, I think they are called health educators across the 774
local governments
in Nigeria. Each of them are designated to work with the health primary health care centers in their state and in their local government. And what are they doing primarily? They are also trying to gather information, feedbacks from the people. What are the challenges with healthcare system? How do we then, so those issues are those feedbacks that they get back to the government to help them further scale up, the revitalization and the revitalization of our health system. It helps. So those information will be used by the federal government, and I must commend them for doing that. And also too, in Lagos State, yes, we have had a lot of effort being put in place by the governor of the state or by the government of Lagos State in ensuring that our health system meets the demands of the people. But I can say that, yes, it is not enough. We need to do more. How do we do more? By ensuring that those health facilities ensure that they give the quality services that they deserve. Number one, let me put this straight to us and to the people that are watching us, that General Hospital is not just a place where you just go to treat headache. We can discongest. That's
why the primary health care centers are there.
We can discongest that the stress and the bottleneck put on the medical doctors or practitioners at the General Hospital. Go to primary health care center. If you get to some primary health care center, people are not even patronizing them. Why? Because what you are supposed to get from them, you are going to General Hospital and making people who had critical issues wait longer time. And that is why many people challenge government at that. But we need to be straight here. I've been to General Hospital to compare with the primary health care center. So they are doing well, but they need to do more. How do they do more? Let us start checking our PACs. We carried out a survey last year and we discovered that there is a particular primary health care center in this state that is not even good enough for an ordinary person to even visit. I had a podcast a few days ago, and this was what I reported in the podcast. So we need to checkmate our PACs and ensure that we build them to a standard where people will no longer go to General Hospital. They will come to that PACs and get the services that they want. And about the second question.
Means and ways of controlling this population. And the myth about it that, okay, if I do family planning, I'm going to have issues medically. And so on and so forth.
We debunked this on this platform last year.
So you can still do that again.
That those are misconceptions that will not help us solve the problem around
controlling
of our population. Because somebody who tell you the moment she take family planning, her tummy start getting bigger, that is a wrong information. I can tell you for free. Number one, our health are different. Our health systems are different. Our body, rather, they are different. What I take, you might not be able to take it because of your own current health status. Now, if a doctor, I've been in an health facility where a woman was cautioned not to do something while she's on that family planning method. She went ahead unknowingly to her, she did it, and she started getting fatter. Because why? Because all the information given to her by the health educator or by the medical practitioner who attended to her, she did not do any. So when people health is very, very how do I put it?
Sensitive.
It's very, very sensitive. Number one, if a doctor asks you not to do this, don't do it. They have their reason for why they ask you not to do it. The moment you do it, you have gone out of the measures that they are putting in place to ensure that you have a good result or outcome for the method. So I think that misconception is a big issue. And how do we mitigate this? Number one, federal government and the state government need to scale up awareness. We need to partner with the media. Yes, we say media is expensive, but we need to spend it to help us, solve all of this problem. If you are not publicizing all of this, if you are not, just like what National Orientation Agency are doing regarding, publicizing the federal government scorecard and the likes, we can also scale up such thing by putting, by bringing all of this issue to the media. Let us start watching it. While we were very young, we used to watch NTA and AIT and NBI. NBI is no more in existence, but we used to watch them, where they come to start publicizing issues to people, and that is where people get wider information about it, and that is one. Number two, the state government also need to start looking at the policies. We need policies that work. We don't want policy that just after drafting it, we keep them under the carpet. No,
the implementation is not there.
The implementation is so important. We need to start focusing on policy implementation. If we put all of this in place, I can bet you people will trust the government, people will trust the facilities, and they can be free to say, okay, I want to access health facility at this location. And finally, let me say that in a way to also mitigate it. Attrition is also very, very big in the PACs. When you get to a primary health care center, it is only one doctor that is attending to you. It's only one doctor that is attending to a large number of people. I think we need to scale up more, recruiting more medical personnel, and then see how we can also put in place policies that will also make them stay. The economy must make them stay. The pay must make them stay, instead of this JAPA syndrome that have limited our medical practitioners or our healthcare, specialists. Thank you.
Okay, I've got two questions, two-prong, because I know he's gotten to the end part of it and wants to do. But first is, what are the challenges in implementing population control policies in a democratic and culturally diverse society like ours? And secondly, how can population control effort respect reproductive rights as well as individual freedoms?
So I would say that number one of the challenges is the cultural barrier. It's a very big issue where we still have some old people who maybe in a family, for instance, or cultural belief that you have to for you to be ascertained that you are certified that you are a member of this family, you have to give birth to more than 10. If you start hearing it in Yoruba, you are a bastard if you are not giving birth to more children. So I think it's a big bottleneck for us that yes, it's taking us, even if in our implementation at our organization, we're still faced with this, and that is why we had to work with Interfaith Group. There's an organization called Interfaith Public Health Group in Lagos State. What do we do with them? We understand that to mitigate cultural barrier, you need the religious group who, many of these people respect their pastors and their imams. So we oftentimes we join them on a monthly advocacy to meet with pastors and imams to say that, please, these people come to you every Sunday. They sit under your tutelage every Sunday, and at every time when they come to pray, maybe 6 a.m., 2 p.m., 4 p.m., 7 p.m., 8 p.m. Can you please help us scale up this message by ensuring that, by giving them that quality information that they need? So we also train these religious leaders. So it has been a big issue in the state, you know, in controlling population control, not just in Lagos State, is across the federation. So which we feel that if there are constant information and we are able to raise ambassadors within these people, and that is why we are coming up with another initiative where we start raising men ambassadors, cultural and traditional ambassadors, who will also be, you know, be the voice, you know, to mitigate this population control challenge. And then the last question
is especially, well, how can population control effort respect reproductive rights and individual freedoms?
Yes, it can, because just like I said, population control can respect people's rights, in the sense that when you are also trying to, you know, advocate to these people, you also respect their decision. You know, there is a space of decision where you allow such person to make their decision. But while they're making their decision, you're also sharing that information that they need, so that by the time they are going back to now say that, yes, I want to do this, they have full control of the decision that they are making.
Okay. I think one part I need to chip in. When you start that men advocate, this you can include Jibola in the
Yes, his name is even number one.
Thank you very much.
His name is number one. He has been a men champion for years.
Thank you.
There was a question.
And you be number two.
There was a question I put to you the other time about the use of contraceptive. Are the women really embracing it? And of course, what should be the position of men? Because some men will tell you that, no, I don't want my wife to insert one particular object or the other. I can have as many children that I want to have. And what are the likely consequences or the dangers of having your population unchecked or not being controlled? Okay,
number one, kudos to women, and I must commend them. We have more women who are enrolled on this. Yes, because it has to do with women, not men.
But we have a way of controlling our own as well.
I want to be mindful of the statement I made.
So but we have a way of controlling our own as well.
Yes. That's where I'm going. When I say that it affects women more, it therefore means that women take
they are the receiving end.
Methods. They are, and at the receiving end too. Number one, when we are talking about injectable, who takes it? The women. Implant, who take it? Women. The only one that concerns men is the condom. But the role of men in this is to support their women, their wives rather, is to support them, to say that I am in need with I'm in with this with you. Even we have more women who take this without letting their husband know. Why? Because they know that if their husband is aware, the husband may restrict them or stop them from getting this method. You understand? So yes, we are now advocating that more men should come on board. If more men are taking this decision, we will have women who will be enrolled on this, and by then we are controlling our population.
And so the dangers of having your population unchecked.
If you don't have it unchecked, you will be having more children that you don't plan for. Yes, you will. You know, just a woman said she took one method. It's just misconception, and eventually she slept with her husband and she got pregnant. And pregnancy. So oftentimes, I would advise people who take FP method, always check yourself. Always check yourself. When you check yourself, you know the level you are. That's just, diversion a bit. So how do we continually check our population control?
And what are the dangers that we are likely to face?
Number one is to ensure that you plan with your family. First, plan with your family. Agree with your own family and say, okay, Daddy Shade, I want to have 2 children. I want to have 3. And you are very close with this decision or this agreement that you are making. It therefore means that you are checking yourself, you are checking the family, you are checking the population that you want to have. And at the level of the government too, we need to start checking our data to know how many number of people do we have in the state? Even in Lagos State here, we are not specific enough. We don't know the number of people living in the state. Either it is 20 million or more than 20 million. But when this population is conducted, we'll be able to start checking through our population. I'll be controlling it at the government level too.
All right. Okay, I think what Jibola was trying to look at, of course, when you talk about population explosion, just look at Lagos and how the infrastructure is stretched, as well as the environmental degradation, where you begin to encroach into places that are supposed to be wetlands because you need to get a place to stay, as well as the fact that your infrastructure can't cater for the education, and even the money you have, a population explosion will affect the amount of money you can dispense to people. But having said that, what do you think government can do, considering that, look, we still don't have a data to work with so that we can plan adequately for people? What can government do in the meantime to perhaps address, because I know those in the health space, they will always advocate for family planning. I personally experienced that with my wife. We had to remove like 2 before we eventually got to settle for one eventually. But in the space of removing the 2, the Lord blessed us with a bouncing baby. Amen. So the challenge is, while you're still going through that, what do you think government should escalate at this point to help the people? Because there's a religious connotation to it. There's this cultural connotation to it. You can't just say, stop having baby, when the person say, excuse me, my parents even did more than this, and here I am. I only had 2, and you are telling me to stop. What am I stopping for? It is God. What they will eat, they will bring it from heaven. Yes. So what should government be doing now to help people, considering that they know that they don't have the resources to take care of an explosive or a population that is burgeoning?
So to help the government, first thing first, government must also sit to plan, sit to plan for the citizens, sit to plan for the number of people in their state. Number one,
even if I'm planning as a governor or as a local government chairman, and Joshua decided to be having children unchecked, then so what would be the impact of my policy at the end of the day?
So that's what we are saying. I said it earlier. I said policy implementation is also another bottleneck, and if you are not implementing policy, people will continue to give birth. If there are no enforcement to checkmate the policy implementation.
You want to enforce the number of children that I'm going to have?
So what we are saying is this. So if the government, I said decision making is also there. And we have spoken, we've talked about awareness. We've extensively talked about awareness. If government is creating awareness and people are not heeding to this awareness, all we need to do is to ensure that we implement policy.
Because what policies are you suggesting?
Like a sanction? Yes. No. There are policies. There are family planning guidelines in the state. If you go to the Ministry of Health, you see some guidelines. So we are not saying that you should thoroughly enforce it, but government should do more in ensuring that the people living in their state are controlled via what? Consistent awareness. So I wouldn't say that government should declare state of emergency on population control. Yes, because more people are coming into Lagos. If you don't know, more people are coming into Lagos State, and it's also affecting our own governance too. It's also affecting infrastructure. It's also, there was a time where they said they reconstructed the Tom Milan Bridge, and somebody went there to start vandalizing. These are big issues that we also need to start looking into. So I think if the government can put in that population sensor in place, it will help the state to start galvanizing themselves and start working with data, and then the state will be safer for everyone.
Okay. I'm just trying to see how best we can drive this policy of government, and how we can get people to buy into whatever government is trying to propagate. I cited an example that, okay, if I decide to have 4 children and the government of the day is telling me, okay, you can use pills, you can do this, you can do that. And you're planning, educating me, and you're planning to build maybe 1,000 housing units. And at the end of the day, your calculation does not tally with the number of children that we have in that community.
So what's the issue now? What is the issue with regard to that? It's because the government is not even sitting on the data. They are not sitting on the data to either address your own issues. Do you understand? So we assume that we are 20 million people. Assumption. But if population is conducted, you realize that we are even more than that. We are more than that. So, but
or less.
But from the government part, what they need to do is to scale up economic reforms. How do they scale up? Instead of saying that you want to build 1,000 housing for Lagosians, why not increase the number? When you know that the total number you are not certain with the number of people living in the state.
So you should build more and plan for the future.
Plan for the future.
Plan for the population explosion.
Yes.
Okay.
But for so many challenges I can see with that, especially for Lagos. Lagos is stretched as it is. Yeah. What do you want to plan more houses? That means we get into the river to build more.
You can see what is happening on the Third Mainland Bridge now.
Third Mainland Bridge.
Did you see what happened along Yanoworo, where they had to push water to create more land? Okay,
so we should do that. How many people can afford that? But I think on a serious note, the conversation about population is something that is very important to us. And as we leave the show this morning, what are your final thoughts on as far as population? Why population we see it as a good thing? Because for all those who want to sell anything, that is good market. But for government, that's a challenge because they don't have enough resources to take care of them. What are your parting words this morning?
Yes, so first and foremost, the government needs to prioritize their efforts, prioritize it, to then sit and then plan for the future of Lagosians and the citizens. What are the things that we are not putting in place that we need to start considering in terms of revitalizing our primary health care centers, so that people who go to have more children can get quality information at their own PACs, at their own PAC level. And government should also prioritize, getting sustainable data that will also help them mitigate some of these gaps and challenges that we are faced with. So when these data are put in place, it helps them plan very well. You can't plan when you don't have data. You plan with data. So they should put all of this together. It will help us. And then youth-friendly centers is also very, very important. One of our advocacy is to also ensure that the government are building our own youth-friendly center and making it more friendly, so that young people who are giving birth at the age of 15, 16 can get this information. I have a 18-year-old lady who has 2 kids already, and what's she doing? Which school has she gone to? So all of these are big issues that we can address.
She has gone to School of Life now.
School of Life.
So
we are appealing to the government to please help us scale up all of this and prioritize, health reforms. Health reforms.
Thank you very much, Mr. Abiodun Ajayi, Public Health Advocate, for joining us this morning.
Thank you so very much.
Okay, we'll take a short break. The Conversation Lagos continues after this. Don't go anywhere.